Nachman, we have breaking news just in a short time ago. Regeneron just announced its antibody drug cocktail prevented 100% of symptomatic COVID infections in its trial, and it also appeared that the infections in the volunteers who received the antibody were less severe than those who did not. So the results, let's take a look at them. They represented the first 400 volunteers from the study that's run by the National Institute of Allergy and Infectious Diseases, and it is continuing to enroll patients, by the way. But the volunteers were at high risk of infection because they lived in the same household as a COVID-19 patient. So half of those patients receive a placebo, the other half get Regeneron's antibodies. Now, while 8 of the 232 patients in the placebo group developed COVID symptoms and tested positive for the virus, none of the 186 patients who received the antibody did. So Regeneron was able to formulate this so that it was given as an injection instead of being given intravenously. So what do you think about, this study, these findings?
So this is a really large step forward for us because it tells us that people who are in a household who they themselves are quite high risk to get severe COVID, we can protect them from that severe COVID. But I want to remind everyone to take a step back and say, that tells us even more so that we need to get everyone vaccinated, because as you remember from the vaccines, that's exactly what we want the vaccines to do, to prevent someone who is exposed to COVID from getting severe COVID and wind up hospitalized. So the antibody cocktails are great, but they do not last the amount of months that we want the vaccine to last, or even years. They are really meant to be a short-term preventative fix. They tell us the COVID is out there, we can help your family, but from stepping back a few feet, we still need to get everyone vaccinated because we don't want to have to keep that revolving door open all the time.
Right, because unlike the vaccines really, teach our body how to recognize the spike protein and then build our own immunity, but the monoclonal antibody drugs actually directly infuse a synthetic antibody against that virus into our system.
Correct. It's a short-term fix. It's a great short-term fix, especially for those patients that are incredibly high risk. But in order for us to get to that area of population or herd immunity, we are still going to need to get all of those people vaccinated.